All right, this video is looking at evaluating psychotherapies. Psychotherapies, remember, are those talk therapies, things like psychoanalysis, humanistic, cognitive, behavior therapy, and group therapies. These are not the biomedical therapies that are on the back of your chart talking about drug therapies and brain stimulation. These are the talk therapies. So, how good are those talk therapies at actually solving people's problems? Well, the effectiveness of each type. Well, the problem is that each type can be effective for different types of disorders. But the other part of the problem is that clients will eventually get better on their own. For the most part, people don't necessarily have to seek therapy for their disorder. They can get better on their own. However, there is research that shows that therapy will help you get better faster. Okay? The problem with trying to evaluate each individual type is that when you are actually going in asking clients and you're asking therapists about the type of therapy that they're either practicing or that they have received, if you, the problem is that psychiatrists or psychologists don't get really a whole lot of negative feedback because, hey, if it's not working for you, oftentimes you will quit or go on to something else, and the psychiatrist or psychologist doesn't know what the problem was. They don't know if they fixed you, quote unquote, fix you. So it is difficult to tell how effective each type is. And there is this idea that there is something called regression towards the mean. It's the tendency for emotional states to return to their average state. So this kind of goes along with this idea that clients eventually get better on their own. What happens is that regression towards the mean works with emotional states and just general personality traits, but it works for a lot of other things. So regression towards the mean is just this idea that, hey, whatever you generally are, if you're generally a happy person, you hit a period of depression, you will eventually regress back towards the average state, whatever your average state is, whatever your generally average happy-go-lucky person is. Or if you're generally an angry person, you'll gravitate back towards that. Other things that illustrate this, things like, for example, New Year's resolutions. I always love New Year's resolutions because every January, people make this resolution. I'm gonna, do something to be better, a better me, right? So I'm going to, lose weight. I'm going to go to the gym more often, or I'm going to, work on reading more often, or I'm going to work on my relationships and being a more positive person. And they may start off strong and start off with great intentions in January, and then slowly over time, you average back to what you normally do, right? So I love this this little poster kind of demonstrating regression towards the mean. It says, I'm opening a gym called Resolutions. It will have exercise equipment for the first 2 weeks and then turn into a bar for the rest of the year. Because that's what happens is that people regress back to what they average and normally usually do. Other things to consider is that clients in therapy are also more likely to improve. Like I said, is that even though, yes, you will get better eventually on your own, you're more likely to improve and improve faster if you are in therapy. It says, as I become less and less nuts, does that mean that you're lower your fee accordingly? That's what this cartoon is saying, which no, that doesn't happen. No one therapy is best overall, but some do better with specific disorders. As we talked about on our therapy chart, behavior therapies work really well with, for example, anxiety disorders or substance abuse, whereas cognitive therapies work really well with depression. Okay. Obviously, the virtual reality simulator, that works really well with anxiety disorders. I don't know how you could possibly use that with something like depression, but it works really well with anxiety disorders, particularly if you have PTSD, believe it or not. They actually have virtual reality in this case where this guy is kind of inserted into this virtual reality where it's similar to whatever trauma he experienced that caused the PTSD, which sounds like it's counterproductive, but it enables them to kind of work through the issues that caused the PTSD in the first place. It puts them back in the scenario. And oftentimes there may be other actors and people in there, and so obviously the therapist is going to be inserted in there that helps them work through their issues. Evidence-based practice is a huge, huge thing. I know a lot of psychologists that talk about this. This is basically the idea that you are trying to make sure that whatever treatment you are using is based on your individual client, whatever their needs are, whatever the therapist's experience is. So meaning what have they had training on? Have they used in the past? What have they found successful? And best available research. So, if research is showing, for example, EMDR, which is that weird, funky one where you have the therapist moving their finger back and forth, and it sounds weird, but hey, if it works, okay? That's what we're looking for. So evidence-based practice is this idea that we have best research evidence, you have the clinical expertise, so you have that expertise of the clinician, the psychologist or psychiatrist, whatever their expertise is, and then whatever the patient's values and their preferences are, because all of that goes into what we call evidence-based practice. So all three of those are really important. And then you also have to consider culture and therapy. It is important that the therapists be very sensitive to their client's culture and religion. Generally speaking, you're not going to have a client seek out a therapist that is from a different culture from them. However, sometimes that happens simply because lack of options, but you have to be respectful. For example, hey, just greeting makes a difference. If you are, for example, a therapist that is treating a highly religious woman, you need to be respectful of how she actually, what she believes and how she treats others. For example, obviously, if it is a Muslim woman, she is not going to see a therapist that's a man. Okay, that makes sense. Okay. So the question becomes, should a therapist share what their personal beliefs are before starting therapy? So should they say, hey, this is what I believe personally, because does that influence the advice and the ideas that they are going to give to their client? For example, what if they have a client that is very sexually promiscuous, and he or she is sexually promiscuous for whatever reason? Maybe that's a histrionic personality disorder, okay? Should that therapist go and share if they believe that, hey, I think that, you should only wait until you're married to have sex, okay? There's good and bad about that. Now, lots of therapists will tell you that they do not share anything personal about with their clients. For example, I know my sister-in-law, even today, she doesn't really treat patients, but she does evaluate individuals coming into her office to see if they need psychiatric help in addition to substance abuse help. She doesn't have anything personal in her office. She does not have any pictures of her family. She does not have, my kids' drawings. She doesn't have kids herself. But same thing with my brother. He's not a practicing psychologist, but he keeps his office very neutral. Because again, you are dealing with individuals that, they have their own problems and issues. And a lot of people make the argument that the therapy should not be about what I believe. It's about what you believe. So even though I do not necessarily agree with what you believe, I need to put that aside for the sake of my client. Preventing disorders is a big thing. There is a lot of research and a lot of advocacy for things to help prevent disorders, obviously particularly things like depression. Providing a healthy environment for people, including communication training and support for stressed families, is a big thing. My two pictures that I forgot to activate on here are kind of showing that, particularly, for example, like military families. This picture is kind of supposed to represent a family that, maybe had a mother or a father that was deployed, providing assistance to those families, because that is a very hot time of high stress. And assistance to those families is crucial and important, so that way that they feel supported, so they don't develop, for example, depression or things like that, because it's a very high stress time. Other example over here is this woman with obviously a newborn. After a baby is born, the new mother goes through a lot of hormone changes. I've experienced that. A lot of hormone changes. And for some people, it can be really stressful, especially if, you had a new baby, you don't have, like, for example, the support of the father. Maybe he's not around at all. Maybe he's, at work. Maybe you're a young mother. Maybe you don't have the financial support, whatever. But it's a very stressful time period. And then you got all these hormones going on, all right, and you're supposed to take care of this little baby down here. And it can be very difficult. And so that's part of the reason why when they do have a checkup, they don't just have checkup for the baby after the baby is born, but they also have the checkup for the mother, not just physically, but they do ask psychological questions of the new mother, and they ask, how are you feeling? How are you doing? Do you have depressed thoughts? They ask questions about, do you have, thoughts about hurting yourself or your baby? Because they want to make sure that they provide that support. Because if it goes unchecked for so long, you can develop postpartum psychosis. So postpartum depression is a real thing, where because of those hormones, they do develop depression because of all those hormones right after that baby is born and all that stress. But if it goes too long unchecked and untreated, it could develop postpartum psychosis, where you have this mental break from reality, and that's when it gets really scary. So the nice thing is that there's lots of assistance and things to help provide support to people that are in that potential danger zone of, developing some sort of psychological disorder. All right, that's it. That's all I got for therapy. Please let me know if you have any questions.